Hello, my name is Maritas Intao and today I'm gonna do the oral administration. Assessment: assess the allergies to medications, client's ability to swallow the medication, presence of vomiting or diarrhea that will interfere with the ability to absorb the medication. So client's knowledge of any learning needs about the medication, perform appropriate assessments specific to the medication. For the planning, assess the equipments that needed for the oral medication. So this is the oral medication that we are needed. So let your client know about the contraindication, the indication, the dosage, and the side effects of this. And second is know your let your client know about the medication that you have to give to her or him. Check the medication ticket, know his name or her name, and the age, the birth date, and after that give the to the client or ask the client if he can drink it orally or he can um, if he can do it to his or herself. So organize the supply, not the medication ticket outside to the bedroom of the client. For the implementation, you need to wash your hands, and before that, observe the infections, appropriate infections control procedures. So, second is prepare your medication ticket or medication tray. For the obtain appropriate medication, read the medication ticket and take the appropriate medication from the shelf, drawer, or refrigerator. Compare the label of the medication container or unit dose package against the order on the medication ticket or a computer printout. Report discrepancy, check the expiration date of the medication, return expired medications to the pharmacy. Use only medication that have clear, legible labels. So, prepare the medication, calculate medication dosage, accurately prepare the correct amount of medication for the required dose without contaminating the medication. While preparing the medication, recheck each prepared drug and continue with the medication ticket again. Now, placing the tablet on the medicine cap. You can place a package unit, dose, capsules, or tablets number into the bottle cap. You do not remove the medication from the wrapper until at the tablets. Keep narcotics and medications that require specific assessment, such as pulse measurement, respiratory rate, or depth, or blood pressure, separate from the others. Break score tablets only. If necessary to obtain the correct dosage, use a file or cutting device if needed. If the client has difficulty of breathing or swallowing, crush the tablets and make sure to make tablet that may be crushed to a fine powder into the pill crusher or between the medication cup. Then mix the powder with a small amount of soft food such as applesauce. For the liquid medication, thorough mix the medication before pouring. Discard any medication that has changed color or turned cloudy. Remove the cap and place it upside down on the counter cap. Hold the bottle so the table is next to your palm, and pour the medication away from the label. Hold the medication cup at eye level and fix. So this is the medication cup and the capsule. So we are now pouring the capsule inside the medicine cup. So here, Medication at level and fill it to the desired level using the bottom of the meniscus to align with the container scale. Before capping the bottle, wipe the lip with a paper towel. We're assuming that we have a paper towel. So, when giving small amounts of liquids, 5 ml, prepare the medication in a zero syringe without the needle. Keep unit dose liquids in their packages and open them at the bedside. So, after that, administer the medication. Provide for client privacy. So, you need to prepare the client by asking for their full name and checking the client's identification band. So, assist the client to sitting position or if not possible to a side-lying position. If not previously assessed, take the acquired assessment measures and as pulse and respiratory pulse rate or blood pressure. So, because the the client needs to sit, because if he drink or she drink the medication liquid, so that he can be or she can be at a proper position. So I will explaining the purpose of the medication and how it helps. So the MX3 capsule or liquid, it will help the clients to, this is a anti-cancer, it will help you to grow your immunity, or it can be to help you give you an energy. So that's it. And give the client sufficient water or prefer juice to swallow the medication. Before using juice, check for any food and medication incompatibilities. If client is unable to hold the pill cup, use the pill cup to introduce the medication into the client's mouth and give only one tablet or capsule at a time. If an older child or adult has difficult swallowing, ask the client to place the medication on the back of the tongue before taking the water. If the medication has an objectionable taste, ask the client to suck a few ice chips beforehand or give the medication with juice, applesauce, or bread if there are no contraindications. If the client says that the medications you are about to give is different from what the client has been receiving, do not give the medication without first checking the original order. Document each medication given. Record the medication given or dosage, time, any complaints or assessment of the client, and your signature. If the medication was refused or omitted, record this fact on the appropriate record. Document the reason when possible and the nurse actions according the agency policy. Dispose of all supplies appropriately. Replenish stock and return the tray to the appropriate place. Discard used disposable supplies. So, for the evaluation, you need to evaluate the effects of the medication, return the client when the medication is expected to the effect to evaluate the effects of the medication and the client. So, after that, preparing for medication so that's it.